It is a pleasure that you are with me again. I hope you and your pet are well. Today we will talk about the following: Lyme disease in dogs, symptoms, treatment, and prevention. Let's start. Lyme disease, also known as Lyme borreliosis, is a bacterial disease that certain species of ticks can transmit to humans, dogs, and other animals. It is caused by bacteria that are carried inside a tick and enter the bloodstream of a dog or person through a tick bite. Once in the bloodstream, the bacteria can travel to different parts of the body and cause problems in specific organs or places, such as the joints, as well as general illness. 1. What are the symptoms of Lyme disease in dogs? Lyme disease is unfortunately a fairly common canine disease. Typical symptoms in dogs are as follows: fever, loss of appetite, reduced power, lameness, can be changeable, intermittent, and recurrent, stiffness, discomfort, or general pain, joint swelling. Symptoms can progress to kidney failure, which can be fatal. Serious cardiac and neurological effects may also occur. The main carrier of Lyme disease is the black-legged tick, also called the deer tick or bear tick. The tick acquires the Lyme disease bacteria when it feeds on an animal that has been infected, such as a mouse, deer, or other mammal, and then transmits the bacteria to the next animal it feeds on. 2. How are dogs tested for Lyme disease? Diagnosis is made by a combination of history, physical signs, and diagnoses. For dogs, the two blood tests to diagnose Lyme disease are called the C6 test and the Quant C6 test. Veterinarians perform both. The C6 test detects antibodies against a protein called C6. The presence of the antibodies suggests an active Lyme infection. C6 antibodies can be detected 3 to 5 weeks after an infected tick bites a dog and can be found in the bloodstream even before the dog shows signs of illness. The next step is to do a Quant C6 test. This, along with your analysis, will help determine if antibiotic treatment is necessary. 3. How is Lyme disease treated? Treatment includes antibiotics, usually for at least 30 days. This resolves symptoms quickly, but in some cases, the infection will persist and long-term medication may be needed. Treatment may also include other therapies intended to resolve or relieve specific symptoms. 4. Can you get Lyme disease from your dog? Dogs are not a direct source of infection for people. Lyme disease cannot be spread from pet to pet, or from pets to humans, except through tick bites. However, a carrier tick could enter your home on your dog's fur and attack you. If your dog is diagnosed with Lyme disease, it's likely that you and any other pets have been in the same outdoor environment and may also be at risk, so it's a good idea to check with your doctor and vet to find out. See if you should test other pets or family members. How can you prevent your dog from getting Lyme disease? Recommendations to prevent ticks include the following. Inspect your dogs and yourself daily for ticks after walks in the woods or on grassy places. In dogs, especially look at the paws, and between the toes, the lips, around the eyes, the ears, and inside the ears, near the anus, and under the tail. The quicker you find them, the less likely your dog is to contract a secondary illness related to tick bites. Learn the proper method to remove ticks. Invest in a pair of fine tweezers used for this purpose. If you can't do this, see a vet. Ask your vet to check for ticks at each exam. You will be able to find any that you have missed. Prevent ticks from jumping on your dog with one of the many vet-approved flea and tick preparations available on the market. Talk to your vet to find the best and most suitable product for your dog. Keep the grass cut as short as possible. Vaccinate your dog. Vaccination could prevent your dog from getting Lyme disease. It may not be appropriate for some dogs, so talk to your vet. Would you like to have more professional information, and especially updated about your dog? Visit the website below in the description of this video. Do not stop subscribing to the channel, comment, and share the video. You are very well, thank you.